Down syndrome is a genetic condition caused by the presence of an extra copy of chromosome 21. It can lead to intellectual and developmental delays, as well as certain physical characteristics. Screening tests during pregnancy can assess the risk of having a baby with Down syndrome. Common screening methods include 1. First trimester screening. Combines a blood test and ultrasound to estimate the risk. 2. Quad screen. A blood test in the second trimester to assess various markers. 3. Non-invasive prenatal testing, NIPT, analyzes fetal DNA in the mother's blood for chromosomal abnormalities. The dual marker test, also known as the double marker test, is a prenatal screening test commonly performed during the first trimester of pregnancy between 11 to 14 weeks. It assesses the risk of chromosomal abnormalities, particularly Down syndrome and Edwards syndrome. This test involves measuring two specific markers in the mother's blood. The results, along with sonography results of NT and NB, maternal age and other factors, help estimate the likelihood of the fetus having Down syndrome or Edwards syndrome. Keep in mind that the dual marker test provides a risk assessment and is not diagnostic. If the risk is elevated, that is more than 1 in 250, further diagnostic tests like amniocentesis or chorionic villus sampling may be recommended for confirmation. It's crucial to discuss the results and potential next steps with a healthcare professional. The first trimester quad marker test is performed between 10 to 14 weeks. It analyzes, along with chromosomal abnormalities, the risk of development of hypertensive disorder in pregnancy. Quadruple marker test is performed between 15 to 22nd weeks for those who have missed dual marker test. It is less sensitive and less specific than DMT, so if dual marker test is performed, then it's not required to perform QMT again. NIPT is more accurate screening method, which tests free fetal DNA in mother's blood. It can be done for twins, but if results are abnormal, confirmation is done by amniocentesis test. NIPT can be done as early as 9 weeks. Amniocentesis is a diagnostic prenatal test that involves withdrawing a small amount of amniotic fluid from the amniotic sac surrounding the fetus. This procedure is typically performed between the 15th and 20th weeks of pregnancy. Amniocentesis and CVS are the only two tests with 100% accuracy in fetal chromosomes.